Colorectal cancer is a leading form of cancer across the United States. And during the month of March, awareness is spread about the disease and the importance of screenings.
Tonight, more on ways to decrease your chance of colon cancer and why health experts say your screening matters. Here's tonight's Healthbeat 4.
Definitely factors that are going to make your chances of colon cancer decrease are going to be that healthy lifestyle.
Colorectal cancer is the second deadliest cancer in the United States, according to Colorectal Cancer Alliance. Nurse practitioner Ashley Deerkop says getting checked is crucial to your overall health and wellness, but you can also lead a healthy lifestyle to decrease your risk.
Participating in physical activity regularly, eating a well-balanced diet, avoiding things like alcohol, tobacco, and something that's really popular nowadays is vaping, so avoiding kind of all of those external factors.
Doctor of Osteopathic Medicine with the Gastroenterology Department at Unity Point Health, Ben Potabaum, says screening for the general population typically starts at age 45. And by screening, he says the most common form is having a colonoscopy.
And if you have family history, though, should be earlier than that. Typically, it's either age of 40 or if you had a family member that was diagnosed before that, 10 years before they were diagnosed.
So what can you look for in early detection?
So that's hard, because early signs, really nothing. It could be as simple as you're having a little bit of blood in your stool, you're having change in bowel habits, maybe a little more constipated than normal, you're losing weight, things like that you notice.
Younger generations are becoming more at risk for colon cancer, and Dr. Potabaum says the disease is deadlier in younger patients.
We don't know why they're on the rise. A lot of speculation. Big risk factors, heavy alcohol, smoking, family history, and then environmental factors, the food we eat, processed foods, the air we breathe, the water we drink.
The disease is highly preventable with screening and getting checked. It matters. Deerkop says there's a lot of anxiety about the prep the night prior to the procedure, but she says it's a simple process and preparation is key.
Stay hydrated. We send in a nausea medicine and then a gas medicine that kind of helps with some pain and discomfort.